Good day, viewers. My name is Amzat Masurat, and today I'll be sharing with us the activities that we carry out in directly observed treatment short course laboratory, a branch of units in medical microbiology and parasitology. However, in this unit, we carry out activities that deals with tuberculosis, starting from the screening test down to the diagnostic test like GNS, the follow-up test, the Mantoux test, as well as HIV screening.
As I've said in one of the videos earlier, that we have different kind of benches or units under medical microbiology. We have blood culture and cerebrospinal fluid bench. We have the directly observed treatment short course unit. We have mycology unit or mycology bench. We have the sexually transmitted infection unit. We have the urine bench, the serology unit, the swab bench, the special pathogen bench, and we have the parasitology bench. Today, I will be taking us through the activities that we carry out or that we deal with in directly observed treatment short course laboratory. Here, we deal with, or let me say, we carry out diagnostic as well as screening tests for tuberculosis. Before I proceed, I would like us to, understand a little bit of what tuberculosis is. Tuberculosis is a disease caused by a bacteria or a bacterium called Mycobacterium tuberculosis, which belongs to a family of Mycobacteriaceae. Mycobacterium tuberculosis was first discovered in the year 1882 by Robert Koch, and it was formerly referred to as tobacco bacilli. So, Mycobacterium tuberculosis got its name as a result of its, cell wall content or cell wall structure. It contains what we call mycolic acid. Thus, the name Mycobacterium tuberculosis. So, Mycobacterium tuberculosis contains mycolic acid, which has a large amount of lipopolysaccharide. So, because of this lipopolysaccharide, you cannot demonstrate Mycobacterium tuberculosis with our normal gram stain because it will not be permeable because of the large amount of lipid content present. So it is usually demonstrated with Zell-Nelson stain with the application of heat. So the heat will make the stain to penetrate the cell wall more easily. Now, talking about the transmission of tuberculosis. How is tuberculosis transmitted? But before I move to transmission, firstly we have to know that tuberculosis, anyone can get infected with tuberculosis. Yes, and also is not a past disease. That is, this disease is also, is also rampant. Is everywhere, and tuberculosis is everywhere in the world. Is in Asian countries, is in African countries, European countries, anywhere in the world. Yes, and also any people who get infected with tuberculosis, it can occur in two ways. People who get infected with tuberculosis can occur in two ways. Is either they come down with tuberculosis disease, or they come down with what we call latent tuberculosis infection. So people with latent tuberculosis infection have this Mycobacterium tuberculosis inside their body, but they will be asymptomatic, and also they cannot spread this disease to another person because it is latent. When they say latent, that is, it is in a dormant stage. It's just there, not doing it. It's not active. It's just there. So, and also 5 to 10% of people with this latent tuberculosis infection can eventually come down with tuberculosis disease, or they might not develop tuberculosis disease throughout their lifespan. So how is this disease transmitted? Tuberculosis affects the lower respiratory tract. That is, it is a disease of the lower respiratory tract, and to be precise, it affects the alveoli. So if you look at this transmission, if you look at the person with the yellow lung, the person with the yellow lung is the one infected. So the aerosol from this infected person contains the tubercle bacilli, and once this aerosol is released into the air, another person can inhale this, thus getting infected. So when somebody gets infected, it can either lead to the tuberculosis disease or latent TB infection. So tuberculosis is airborne pathogen. It is majorly through airborne. When an infected person, sneeze, coughs, speak, or sings, so the release of the aerosol or droplets contains the tobacco, the bacilli. So the bacilli, once it is inhaled by another person, the person becomes infected. Now let's look at the pathophysiology. If you look at this pathophysiology, you see that we have the latent infection. The first image is latent infection, and the second one is talking about the active disease. So the latent infection here, once a person inhaled the bacilli will travel down to it will migrate down to the alveoli. Once it gets to the alveoli, the antigen presenting cells, which include the dendritic cells and the macrophage, are the first line of defense. So they attack the bacilli by trying to engulf it, which is known as phagocytic activity. So this bacilli will try to block this phagocytic activity, thus breaking the first line of defense. So once these dendritic cells and the macrophage cannot destroy this bacilli, the bacilli will now enter into the interstitial space, either through direct migration of the bacilli into, if you look at this diagram, you see this interstitial space or lung parenchyma. Yes, so they move towards that place, or it can also get there through the migration of the infected dendritic cells. So the infected ones can also migrate the bacilli to this lung parenchyma. On getting to this place, the T cells and the B cells will migrate towards this lung parenchyma and form like a wall. Yes, a wall around the bacilli. So the T cells and the B cells will form like a wall, like they are trying to surround the bacilli and prevent it from spreading to other parts of the respiratory tract. So by the time they surround it, it refers to as what we call granuloma. So they are trying to contain it here so that it will not migrate and it will not replicate and spread to other parts. So this is what happens in latent infection. That is where it stops. But for active disease, the bacilli will begin to replicate within the granuloma, and once the bacterial load gets too much, it will destroy the granuloma and the granuloma will burst, so thereby releasing the bacilli. So this bacilli will now move to the nearest lymph node. By the time they move to the nearest lymph node, they will enter into other parts of the body, thereby leading to what we call extrapulmonary TB. That is, they have left the lung and moved to other parts of the body, like the brain, the spinal cord, the kidney, the stomach. So leading to what we call extrapulmonary TB. And once they get to other side, they begin to replicate there too. So that is extrapulmonary TB. Now, what are the major signs and symptoms? We have chronic cough. Yes, chronic cough with blood. The person begins to spit blood, and also pain in the chest, weakness or fatigue, weight loss, appetite loss, chill, fever, and sweating at night. Those are the signs and symptoms. Then activities. Then I said we carry out diagnostic tests and screening tests in Delta laboratory. So the first test I'll be talking about is we have gene expert. So this gene expert is like a molecular testing method, an amplification testing method where we quantify the amount of bacilli that is present inside the sample. So, and also we have Zionelson stain. This is used for follow-up. It is used to check for Mycobacterium tuberculosis inside the sputum of people that are already taking drugs. So it is used to check if there are still any bacilli or the drug has cleared the bacilli completely. So the best sample is for Zionelson stain. The best sample is early morning sputum sample before brushing of teeth or before eating. Before brushing of teeth and eating, yes. The early morning sample, early morning sputum. So we also have Mantle's test. This is used for screening latent TB infection. Yes, it is used to screen for latent TB infection. I've already talked about latent TB infection earlier. So for the course of this little talk here, I'll be dwelling much on the gene expert. So talking about the gene expert, this machine is a gene expert machine, and it operates majorly on real-time polymerase chain reaction technique. Yes, it works based on real-time polymerase chain reaction technique. So it helps to detect the DNA of this Mycobacterium tuberculosis. When we are talking about real-time polymerase chain reaction, we are talking about the molecular basis. So here, this machine helps to detect the DNA. Yes, it detects the DNA, and also it helps to check if these bacteria are already resistant to rifampicin. Rifampicin is the major drug that we use to treat tuberculosis. Yes, so it helps to detect the DNA, also helps to confirm if this bacilli is already resistant to the rifampicin drug or not. So looking at this image, our preferred sample also is sputum. Also, this machine can also work on extrapreliminary samples. Yes, that is if you are really suspecting if the person has a supreliminary TB, like in the urine. You can use urine sample. You can use stool sample, especially for children between 0 to 14 years of age, where they have difficulty in producing, sputum. So you got urine, sputum, acidic fluid, pleural fluid, etc. So now we have the first. This method, this gene expert method, is a semi-automated method. That is, we have one part where we carry out manual work, and we have the other part where we make use of machine. So talking about the manual part now, we carry out all this manual process inside biosafety cabinet level 2, which is very, very important. So the sample we contain, after getting the sample from the patient, the preferred sample is sputum and not saliva. Sputum, yes. So at least 1 ml of sputum. So we have a reagent. We have a reagent that we use to dilute this sputum sample. So this reagent is called N-acetyl L-cysteine sodium hydroxide. I repeat, N-acetyl L-cysteine sodium hydroxide. So 1 ml of sputum to 2 ml of this reagent. So that's how you dilute it. That is, it will reagent to sample will be 2:1. So after this, it will be, you shake the sample container, the container containing all the sample together with the reagent. You shake it vigorously, like for 20 minutes, for 20 times, and you incubate for like 20 minutes. Then after that, you shake like 10 times again, and you incubate for like 10 minutes. The reason why we are shaking and incubating is because this reagent has 3 action. It confers 3 action. That is, it carries out 3 action on this sputum or any sample that we are dealing with. So firstly, it will denature, or let me say, it will destroy all other bacteria, leaving only Mycobacterium tuberculosis. Then it will digest the cell wall of Mycobacterium tuberculosis so that it will expose the DNA for us to work with. That we are working with the DNA now. So it will also decontaminate all the bacteria, all the pathogen present. It also decontaminate them. So after incubation, the next thing is to transfer 2 ml out of this dilution into cartridge. You call it look at this cartridge. Yes, it has a inside this cartridge we have the PCR reagent present inside this cartridge. So you transfer 2 ml of the dilution into this cartridge. So after transferring 2 ml, then you take this cartridge to the scanner where you scan it. After that, you place it inside this gene expert machine. After placing inside the gene expert machine, you are going to enter the patient's name, the patient laboratory number inside the computer software, and you program the machine. So usually the machine runs for about 1 hour 26 minutes. So inside here, the machine will try to detect the DNA if it is there. 1, it will quantify it. I said we are using real-time polymerase chain reaction. Real-time is also known as quantitative polymerase chain reaction. It does not only help to amplify or detect the DNA, it also helps to quantify the amount of DNA present in that particular sample. So it also helps to detect if this Mycobacterium tuberculosis, if the particular bacilli has developed resistance to rifampicin, because rifampicin is the first line drug that we use to treat Mycobacterium tuberculosis. So it runs for about 1 hour 26 minutes. So that is that. Then let's talk about the interpretation of the result. So after, even before it's finished running the sample, it would have started it would have started indicating inside the computer software if there's any presence of Mycobacterium tuberculosis. If it is present in the sample, it will, before it's finished running, before 1 hour 26 minutes, it would have started showing it on the computer system that this particular sample has Mycobacterium tuberculosis. As I've said earlier, I said it quantifies. So the interpretation of results will tell us if it will not be as MTB detected as high, that is if there is high viral load. MTB detected as medium, MTB detected as low, and MTB detected as very low, or there is no MTB detected, that is if there is no MTB present in the sample. So now it also helps to, as I've said earlier, it does not only help to detect the MTB alone, that is Mycobacterium tuberculosis alone. It also helps to detect if this Mycobacterium tuberculosis has developed resistance to rifampicin. So for the interpretation of the rifampicin, it will say RIF resistance detected, that is if mutation in the RPOB gene has been detected. So this RPOB gene is present inside the Mycobacterium tuberculosis. It's a gene present inside Mycobacterium tuberculosis. So, and this rifampicin is designed to destroy this RPOB gene. So by the time there's mutation in this Mycobacterium tuberculosis, this rifampicin will not be able to destroy the MTB again. So that is, it has developed resistance against the drug. So it helps to also detect if there's rifampicin resistant or not. So that is all I'll be talking about. That is about Gene Expert machine. So the machine is a very versatile machine. So it does not only help to detect the DNA alone, it also helps to quantify and also helps to detect if this particular Mycobacterium tuberculosis has developed rifampicin resistance. So in short, what I want us to understand here is that firstly, anyone can come in contact with TB, especially if you have moved closer to somebody that is already infected with the disease. And also, it's not a disease of the past, it's still very, very much rampant. And also, TB can happen anywhere. It can happen in African countries, in Asian countries. And also, TB infection comes in two ways. Is either the person developed TB, tuberculosis disease, or latent tuberculosis infection. So for latent tuberculosis infection, the person can get tested and be treated, because about 5 to 10% of people with this latent tuberculosis infection can either can develop or can lead to tuberculosis disease. And also, some people might not even develop this disease throughout their lifetime. So the best thing for people, if somebody thinks that he or she is already exposed to somebody that is having tuberculosis, the person should try to get tested, and if it is possible, the person should take drug to overcome it.
That is all about Gene Experts. Once again, my name is Musurat, and I would like you to subscribe to our channel, like, share, and comment. Thank you.